Many men over 50 believe that weaker erections are inevitable. But what if I told you that a urologist-recommended secret to harder, more reliable them? The key to a strong erection is blood flow. As men age, muscles around the pelvis can become tight or weak, or this creates a physical bottleneck. Today, we're going to fix that. I'm going to show you the 5 best stretches that can help release this tension and support powerful blood flow. These aren't random exercises. They are targeted movements designed to awaken and relax the most important muscle group you probably never think about, your pelvic floor. Let's first understand the anatomy. The pelvic floor is a sling of muscles that supports your bladder and bowel. It also plays a critical role in erectile function. Typically, a key muscle called the pubococcygeus or PC muscle helps trap blood inside the penis to maintain an erection. Think of it as a gatekeeper for hardness. When these muscles are chronically tight from sitting, stress, or improper exercise, they can't function optimally. They restrict flow when you need it most. The goal of these stretches is twofold: to strengthen these muscles if they're weak, and more importantly, to teach them to relax and allow for maximum blood flow. Our first and most important exercise is the Kegel. We must first learn to isolate and control the PC muscle before we can effectively stretch the area around it. To find this muscle, try to stop the flow of urine midstream the next time you use the restroom. The muscle you squeeze to do that is your PC muscle. Do not do this regularly while urinating. Just do it once to identify the feeling. That is the muscle we are targeting. Hyperprotion. To perform a Kegel simply sit or lie, squeeze as that PC muscle and hold for a count of 5 seconds. After holding for 5 seconds, relax the muscle completely for a count of 10 seconds. This relaxation phase is just as important as the contraction. Aim for a set of 10 to 15 repetitions. Evidence suggests that performing this routine up to 3 times per day can significantly support muscle control and function. Mastering the Kegel provides the foundation. Now let's work on the surrounding areas that inhibit blood flow. This brings us to our second stretch.
Stretch number 2 is the glute bridge. Many men have weak glutes and tight hip flexors from prolonged sitting, which tilts the pelvis and restricts circulation.
To perform this, lie on your back with your knees bent and feet flat on the floor, about hip width apart. Place your arms by your sides with your palms down. Engage your core and glutes and lift your hips off the floor until your body forms a straight line from your shoulders to your knees. Avoid arching your back. Hold this position at the top for about 15 to 30 seconds, focusing on squeezing your glutes. You should feel a stretch in your hip flexors and activation in your glutes. Slowly lower your hips back down to the starting position. Aim to perform 10 to 12 repetitions of this hold. This helps realign the pelvis for better blood flow. That realignment is crucial. When your pelvis is in a neutral position, your arteries have a clear, unrestricted path. This is a simple but powerful mechanical advantage. Start by kneeling on one knee, as if you were about to propose. Your front leg should be at a 90-degree angle, and your back knee should be on the ground. Keeping your back straight, gently shift your hips forward until you feel a stretch in the front of the hip of your back leg. Do not lean your torso forward. To deepen the stretch, slightly tuck your tailbone under, engaging your glute. This will intensify the stretch right where it's needed most. Hold this position for at least 30 seconds, breathing deeply. Then, switch legs and repeat on the other side. This helps to lengthen those tight muscles. These hip flexor muscles weave deep into your core and run alongside major arteries that feed the pelvic region. Releasing them is non-negotiable for optimal function. We've addressed control with Kegels and anterior tightness with the last 2 stretches. Now we need to open the hips and release the inner groin. This brings us to stretch number 4, the supine happy baby pose. This pose might feel unusual at first, but it is phenomenal for releasing the pelvic floor. Lie on your back. Bring your knees toward your chest. Keep your head and shoulders on the floor to avoid straining your neck. Now, reach and grab the outsides of your feet with your hands. If you can't reach your feet, you can hold on to your ankles or shins. Gently open your knees wider than your torso, bringing them towards your armpits. Keep your ankles directly over your knees so your shins are perpendicular to the floor. Flex your feet and gently push them up into your hands as you pull down with your hands to create resistance. The key is to relax your groin and pelvic floor. Hold this for up to a minute, breathing deeply into your belly. This stretch releases tension in the hips, groin, and lower back. The inner thigh muscles, or adductors, attach directly to the pelvis. When they are tight, they pull on the pelvic floor. This stretch directly addresses that. Remember, the goal is a gentle stretch, not pain. Consistency with this pose can yield significant improvements in flexibility. We are now at our final and perhaps most powerful stretch for ovum beat and mobility. Stretch number 5 is the deep squat, also known as malasana or the garland pose. This stretch opens the hips. Stand with your feet slightly wider than your hips, with your toes pointed slightly out. This stance is key for allowing your hips to open properly. Keeping your chest up and your back straight, slowly lower your hips down as if you are sitting in a chair. Go as low as you can comfortably. This elbow pressure will help to open your hips even further. If you find your heels lifting, you can place a rolled up towel or a book under them for support. If the deep squat is too intense, you can also sit on a yoga block or a low stool to support your weight while still getting the benefits of the hip opening. Try to hold this pose for 1 minute, focusing on your breath and allowing your pelvic floor to relax and lengthen. So there you have it, the 5 key stretches. Let's do a quick recap of the entire routine so you can easily incorporate it into your daily life. Number 1, foundational Kegels, to isolate and strengthen the PC muscle. This is your control center for erectile function. Number 2, the glute bridge, to correct pelvic tilt and activate your glutes, creating an open pathway for blood flow. Number 3, the kneeling hip flexor stretch, to release the chronic tightness at the front of your hips caused by too much sitting. And number 5, the deep squat, the ultimate pose for comprehensive pelvic mobility and improved circulation throughout the entire region. The most important factor in this routine is consistency. Performing these stretches for just 10 to 15 minutes each day can make a substantial difference. Think of it like brushing your teeth. It's a daily hygiene practice, but for your pelvic health and sexual function. Make it a non-negotiable part of your day. Over time, these stretches may help to retrain your muscles, improve your posture, and support the robust blood flow necessary for strong, lasting erections. This approach tackles a root physical cause of erectile issues in many men, rather than just addressing the symptoms. It's about restoring natural function. Our modern lifestyle of sitting in chairs and cars has created this problem of pelvic dysfunction. These stretches are the antidote to that modern problem. Remember to breathe deeply during all these stretches. Deep diaphragmatic breathing helps to relax the nervous system and the pelvic floor muscles even further. Do not get discouraged if you are not very flexible at first. Your body will adapt over time. The goal is progress, not perfection. This isn't just about sexual performance. A healthy pelvic region is linked to better bladder control, reduced back pain, and overall vitality as you age. By taking control of your physical mechanics, you are empowering yourself to maintain a high quality of life and confidence for years to come.
Many men suffer in silence, assuming nothing can be done. But these physical, proactive steps can be incredibly effective.
Commit to this routine for 30 days. That's the challenge. Do it every single day and pay close attention to how your body feels. Improved blood flow also means improved nerve sensitivity, which is a key component of both arousal and pleasure. The benefits are comprehensive. Also ensure you are properly hydrated. Water is essential for muscle function and blood volume. It complements the work you are doing with these stretches. Combine this stretching routine with a healthy diet, regular cardiovascular exercise like walking, and proper stress management for the best possible results. Now, it's very important to state that while these exercises can be highly beneficial for many, they are part of a lifestyle approach. If you have cardiovascular disease, diabetes, or persistent these conditions require medical management, and your doctor can help you determine the safest and most effective path forward for your specific situation. This routine is a powerful tool you can use to support your body's natural mechanics. It puts the power back into your hands. Start today. Be consistent, be patient with your body, and reclaim the physical confidence that is rightfully yours. Thank you for watching. Take this knowledge, apply it, and take the first step toward improving your pelvic health and performance.